I am Dr. Rasik Shah, Senior Pediatric Surgeon associated with SRCC Children's Hospital managed by Narayana Health. Today, I tell you about some of the surgeries which we carried out at SRCC Children's Hospital. We do almost all kind of surgeries at this hospital, but something which is not done everywhere includes advanced minimal access pediatric surgery, complex tumor surgeries, and complex fetal malformation, which we take care at the time of delivery. And there is a reason for doing everything. Now, advanced laparoscopic pediatric minimal access surgery includes in abdomen like choledochal cyst, pyeloplasty, Achalasia cardia surgery, pull-through surgeries for Hirschsprungs and Imperforate hernias, diaphragmatic hernia repair, lobectomies, and many more. Now, for these surgeries, you need to have dedicated team of surgeons, anesthetics, post-operative care in PICU or NICU. You need support of blood bank, and all these facilities are available at SRCC Children's Hospital, and that is the reason we can carry it out well. The second surgery I said was tumor surgery. Now, in tumor, many tumors are so complex, it needs team of experienced surgeon. And not only for an example, if it is wing tumor with the advancement into the inferior vena cava, we need to tackle it along with the cardiac surgeon. So all these facilities again are very easily available at SRCC Children's Hospital. Along with that, many of these patients we need a lot of blood. Uh, so we have very good blood bank facilities as well. The third part, which I told you, that fetal malformation. Now, many fetuses which are detected to have malformation who needs to be operated at birth, that again can be managed well at our hospital, which is SRCC Children's Hospital, because we have very good NICU care as well as pediatric anesthetists who can give anesthesia without any issues. So, for an example, if the child is detected to have congenital diaphragmatic hernia or tracheoesophageal atresia or duodenal atresia, all these surgeries can be performed at this hospital using minimal access pediatric surgery because we have again dedicated equipment, dedicated surgeons who are experienced, as well as pediatric anesthesia, team of pediatric anesthetists, and very good NICU and PICU care. So, if your child has anything of this, any complex malformation, any complex disease which cannot be taken care at any other place, we can take care of them in SRCC Children's Hospital. Thank you very much.